afternoon and welcome. My name is Perry Halkitis, and I am the very proud dean of the Rutgers School of Public Health. On behalf of the faculty and staff, I welcome all of you to our convocation that celebrates the accomplishments and achievements of the class of 2026. Please be reminded that this is a university event, and it's taking place to celebrate the culmination of our students' hard work and earned degrees. It is a momentous event for all of our graduates and their guests. Activities that disrupt the ceremony will not be tolerated. Standing for the national anthem and lift every voice.
Lift every voice and sing till earth and heaven ring. Ring with the harmonies of liberty. Let our rejoicing rise high as the listening skies. Let it resound loud as the rolling sea. Sing a song full of the faith that the dark past has taught us. Sing a song full of the hope that the present has brought us. Facing the rising sun of a new day begun. Let us march on till victory is won. God of our ears, God of our silent tears, thou who has brought us thus far on the way, thou who has by thy might led us into the light. Keep us forever in thy path, we pray. Lest our feet stray from the places, our God, where we met thee. Lest our hearts, drunk with the wine of the world, we forget thee. Oh, shadow beneath thy hand, may we forever stand true to our God, true to our native land. Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming. And the rugged red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Please be seated. Before we get started, I'd like to welcome somebody who doesn't really need a big introduction, Dr. Rafael Perez Figueroa, Associate. Right, I need this energy all afternoon, okay? You got it? Great. Associate Dean for Community Engagement, Population Health, and Global Public Health, to read the Rutgers University Land Acknowledgement, Dr. Perez Figueroa.
Buenas tardes. Thank you, Dean Halkiris, and congratulations, graduates. The Rutgers University School of Public Health is committed to the history, present reality, and future possibilities between indigenous people, this school, the land, and the environment. We acknowledge that the land on which we stand is the ancestral territory of the Lenape people. We pay respect to indigenous people throughout the Lenape diaspora, past, present, and future, and honor those who have been historically and systematically disenfranchised. We also acknowledge that Rutgers University, like New Jersey and the United States as a nation, was founded upon the exclusion and erasure of Native communities. And while acknowledging this, we commit to work in the pursuit of equity and justice. Dean Halkiris.
Graduates, take a moment. Reflect on what you have achieved and what this milestone means for you, for your families, and for those who supported you along the way. This is a moment, yes. This is a moment of celebration, but it is also a moment of reckoning. Public health in this country is facing one of its most challenging periods in recent history. We are confronting the rise of pseudoscience, the spread of misinformation, and a diminishing commitment to the humanity that must guide our work. These forces are not abstract. They are affecting the well-being of individuals, communities, and entire populations. Plain and simple, people are getting sicker, dying younger, and suffering from illnesses that we know how to prevent. And yet, these challenges are not new. From the earliest resistance to vaccines to the wide variation in how people respond to public health guidance, history has shown us that biomedical science alone is never enough. The same dynamics that fuel infectious disease also shape chronic disease. What we see with viruses, we also see with heart disease, obesity, addiction, and mental health. Human behavior, belief, social and political contexts are always at the center, and all diseases require a person-centered approach. Our approaches can no longer simply focus on data analytics or on policies made by people out of touch with those who are impacting suffering. Human behavior, belief, and context are always at the center. In my last book, I argue that one of our great failures have not been scientific, but human. We have made extraordinary advances in biology and medicine, but we have not kept pace in understanding people, their fears, their emotions, their beliefs, and the social realities that shape how they act. Pandemics are not driven by pathogens alone. They are driven by people. As a proud child of Greek immigrants, I often return to the wisdom of those who came long before us. Hippocrates, the father of Western medicine, who is from the island where my parents were born, reminded us that diseases are not from the gods, but from the foolishness of men. And Pericles, the great Athenian statesman, taught us that those who do not contribute to the common good diminish the whole of society. These ideas still hold, and they speak directly to why human beings must be at the center of our public health efforts. I suspect that you will hear similar ideas echoed by many of our speakers today, including our honored guest, Dr. Vin Gupta, whose words offered calm guidance during those chilling early days of the COVID-19 pandemic. Thank you for doing that, Dr. Gupta. I have lived this work not just studied it. From the early days of HIV to COVID-19 to the emerging threats we now face, I have seen how biomedical science alone is not enough. I have seen how fear and misinformation can undermine even the strongest interventions, and I have seen how compassion and trust can save lives. I have also seen this through my brother, who has lived the last 15 years with progressive multiple sclerosis, and to whom I dedicated this book as the bravest person I know. His experience reminds me that public health is never abstract. It is about real people, real lives, and real consequences. I also return to the words of my mother, a woman who came to this country at 15 with limited education, but with a wisdom that continues to guide me. With a beautiful accent that filled the room like music. In her imperfect but powerful English, she would say to me, "Perry, we may disagree with people, we may dislike them, but we never hate them." These words have stayed with me. They ground me, especially now. And yet, as I look at where we are today, I find myself returning to a difficult truth. We are living through a moment in history where hate too often speaks louder than compassion, where bullies too often mistake cruelty for strength. We see them in governments, in communities, and institutions, and sometimes even among ourselves. People who deceive, people who lie, people who manipulate and divide. People who try to climb upward through gossip and manipulation, who undermine others behind closed doors, who chip away at the people around them, believing that someone else's diminishment is the same as their own success. Every piece of gossip, every whisper, every act of hearsay is nothing more than a reflection of their own insecurity and their lack of self-worth. People who prey upon the vulnerable because they mistake power for greatness. And to those bullies, I say this. Number one, greatness, my friends, is not about power. It is not about titles, about intimidation, manipulation, or fear. Greatness is about the good works you do in this world. It is about how you lift people up when they are suffering, how you stand beside the vulnerable, how you speak the truth when it is inconvenient, how you leave humanity better than you found it. And number two, you may believe that your cruelty is kryptonite to people like me, that your attacks weaken us, that your whispers, your manipulation, your smallness can diminish our light, but you're wrong. You are not our kryptonite, you are my yellow sun. Because this is a Superman thing, right? We got that? Okay, good. Because every act of cruelty reminds me why compassion matters. Every act of injustice reminds me why public health matters. Every attempt to silence the truth reminds me why we must speak louder. And it reminds me to stay in the game, to lead this institution in the way it deserves to be led. So graduates, as you leave the School of Public Health and enter a world aching for healing, I ask two things of you. First, never lose your humanity. Understand that hatred is often born from fear, emptiness, and wounds left unattended. Meet the world with empathy, even when the empathy feels difficult. But second, and just as important, do not confuse empathy with surrender. Stand up and call out cruelty. Defend those who have no power. Fight for science. Fight for the health and dignity of every human being. And when the world tells you to grow smaller, quieter, safer, I ask you to instead to grow louder, braver, more compassionate. More relentless in your belief that humanity can be better than this moment. This is the work of public health. This is the work of justice. So I ask you now, graduates of the School of Public Health, are you ready to join me in this fight? Louder! Great, because if you're with me, then together we can carry on. Congratulations, graduates. sometimes people are brought into your life through magical, interesting ways, and then they become this really important person in your life. And I'm very happy to introduce our next speaker. Dr. Mariam Rashid is one of our alums and the chair of our school's Dean Leadership Council. Dr. Rashid is also the Associate Director of Racial Equity and Justice at the Center for American Progress, where she examines how social and economic policies shape health and life outcomes. Her research focuses on inequities in law and policy, with a particular attention to women's and children's rights. I welcome to the podium Dr. Rashid.
Hello. If someone told me 10 years ago that I would be speaking to the graduating class of 2026, I would have not believed them. I would not have been able to foresee the path that this degree laid out for me since graduating. When I graduated from this very program 10 years ago, we were a much smaller class, only 134 graduates. It is clear to me that Dean Halkitis has expanded this program, putting Rutgers on the map. With such a large program comes larger goals, which is what I am here to talk to you about today. I chair the Dean's Leadership Committee. Our small but mighty group of 20+ individuals is made up of past alumni and prominent figures from around the state and from around the country. We meet monthly to support the school's strategic vision and to create new opportunities for students and for the program and for the field. That means investing in you financially and intellectually. That means opening doors and making sure that the Rutgers School of Public Health continues to grow not just in size, but also in distinction. And I want you to know that the commitment does not end today. This committee is a pipeline, and alumni sit at the table. One day, one of you can sit at this table. At a time when the world does not support science, I want you to know the power of your degree. Every day I walk into work and I bring this degree with me, not framed on a wall with me, but in the way that I read a study with me, in the way that I question a data source, in the way that I sit across from lawyers, lobbyists, and Congress members, and I know things that they don't know. You are leaving here. Sure, go ahead. You want to save your claps, because now you are all leaving here with that same capacity. You can read a research paper. You can evaluate methodology. You know the difference between a correlation and a causation, between a confidence interval and a talking point. Most Americans cannot do that. Most of the people making decisions about public health in this country cannot do that. And that is not a small thing. That is your superpower. The world needs that superpower, so use it. Walk into every room with the confidence of somebody who has done the work, who has done the research, and who knows the difference, because you have and you do. John Lewis called it good trouble, necessary trouble, and I want you to understand what that means, really understand it. Good trouble has never been easy. Long before we had civil rights in this country, people made good trouble at an enormous cost. They marched, they sat at counters, they crossed bridges, knowing what was waiting on the other side for them. That is a tradition you are stepping into today. Our good troubles look the same, and other times they look very different, but it is part of the same story. You will walk into rooms with evidence and expertise, and you will speak the truth. You will speak the truth to people who do not want to hear it. That takes courage, and you have it because of this degree, because of this school, and because of the training that the school gave you. That is something that you should celebrate today. You are not just graduates. You are the next chapter of a very long and honorable line of people who refused to stay quiet when it mattered at a time when science is under attack. 10 years from now, one of you may be standing at this very podium, leading the Dean's Leadership Committee. And I genuinely hope, that the world you are describing to the graduates of 2036 look different than the ones we are navigating today. I hope you tell them about the moment you chose not to be silent, Because we don't need thoughts and prayers, we need policy and change. And that is exactly what you are trained to deliver. Be proud of where you came from, this degree, this institution, this moment, because it matters. Push harder than you think that you can. And when you get to that next room, that next table, that next level, I want you to reach back. Bring somebody with you. That is what public health is, and that is what we do. The Dean's Leadership Committee will be here as you grow. We have been building something at this school, and you are now a part of it. We are invested in your success, your careers, your good trouble long after today. Congratulations, class of 2026, wow. Remember, this is only the beginning for all of you.
Thank you, Dr. Rashid. Before I introduce the next person, I just want to take a moment and also acknowledge that the person I'm going to introduce is Dr. James Doherty, who also serves on the Dean's Leadership Council. And next to Dr. Doherty is Dr. Gloria Bachman, who also serves on the Dean's Leadership Council as a professor here at the university. And both were inducted into the Rutgers Alumni Hall of Fame this year. One of the first emails I received when I assumed the role of dean was from our next speaker, who I turn to often for sound advice, movie recommendations, theater recommendations, and assorted other things. Use your imagination. Dr. James Doherty is the former chair of the Rutgers University Board of Trustees and current vice chair of the Rutgers University Board of Governors and a member of our school's leadership council. He also is involved in many organizations on campus and recently gave a $3 million gift to fund M.P.A and Halkitis, endowed chair in LGBTQ public health at the school, which is key to the launching of our Rutgers Institute for Sexual and Gender Minority Health. Thank you for that, Dr. Doherty. Dr. Doherty is a great spokesperson for our school and someone who has become a wonderful friend. Dr. Doherty brings greetings from the governing board of the university. Dr. Doherty.
Thank you. Good afternoon. Dean Halkitis, Dr. Gupta, faculty members, students, family, friends, and distinguished guests. I extend my sincere congratulations to Dr. Halkitis and his esteemed staff on the successful organization of another convocation ceremony, marking his 9th tenure as the Dean of the School of Public Health. In the face of the current public health challenges, Dr. Halkitis' insights and experiences have proven invaluable in guiding the school to equip our students with pertinent, forward-thinking, and transferable skills that are highly sought after in the job market. Since Dr. Halkitis' appointment, the school has witnessed significant growth in both size and reputation. He has recruited exceptional new faculty members, fostered the development of innovative areas of study, such as LGBTQ+ health, population aging, and mental health, and ensured that students receive an education and experience grounded in social justice and health equity across all initiatives, both domestically and internationally. Public health is a discipline that holds the principle that a long and fulfilling life should not be contingent upon one's geographical location, socioeconomic status, personal relationships, or ethnic background. However, reality often deviates from this ideal. It's imperative to maintain a steadfast commitment to the importance of your skills and contributions. You are indispensable, and your value will remain unwavering, even during periods when societal discourse is dominated by misinformation rather than scientific evidence and truth. In reference to misinformation, 6 years ago at this time, the global community recognized the paramount importance of public health and the critical need for scientific guidance during a global pandemic. In March of 2020, the future was uncertain, and survival was a challenge. However, We were fortunate to have the expertise and experience of two individuals on the stage today. Dean Halkitis was frequently featured on television and print media, providing guidance on how the population could mitigate the disease's spread. Dr. Gupta, on the other hand, delivered nearly daily reports and information on television. I extend my sincere gratitude to both of you on behalf of millions of people. As a friend of Dean Halkitis, I had the privilege of maintaining regular contact with him. Similarly, I am deeply appreciative of Dr. Gupta's daily reports, which I eagerly anticipated. Despite the dire circumstances, you both provided hope and guidance during the second plague of my lifetime. It is important to acknowledge that while many individuals held press conferences and appeared in the media, some engaged in misinformation, such as promoting the use of bleach. If you didn't live through it, you wouldn't believe it. However, Dean Halkitis and Dr. Gupta remained steadfast in their commitment to truth and provided essential guidance during this challenging period. This is public health. The Rutgers School of Public Health stands committed to scientific rigor, evidence-based research, and the fundamental rights and dignity of all individuals, including immigrants, the LGBTQ+ community, and others. We trust that during your tenure at the Rutgers School of Public Health, you have acquired not only the technical skills necessary to advance public health as a discipline, but also have developed a profound appreciation for the human aspects that imbue our work with purpose. We are immensely proud of our esteemed faculty, dedicated staff, and nearly 3,000 alumni, whose influence extends from our own communities in New Jersey to every inhabited continent worldwide. On behalf of the entire administration, faculty, and staff of Rutgers University, we extend our heartfelt congratulations. Thank you very much.
See what? I'm like a lucky guy, right? I have all these like amazing people in my life. Thank you, Dr. Doherty. I would like now to introduce somebody else who's pretty amazing. Luis J. Cordero. Luis, will you please join me on stage? Hello, Luis. Good to see you. Don't be shy. Come closer. Luis is receiving his Master's of Public Health degree and will be providing today's address to the class of 2026. He is also the recipient of the 2020, you see this? Yeah. That's the 2026 Stanley S. Bergen Jr. Medal of Excellence, which is the school's highest honor and is given to one exceptional graduate for distinguished academic achievement. Impactful public health research and meaningful service to the school and community. Luis has distinguished themselves not only through their exceptional academic achievement, but through the depth of their character, leadership, and service. I had the pleasure of working with Luis while we were in London last year in our HIV course, and it was amazing. London class, yay! It is my honor to present to you Luis Cordero.
Good afternoon, esteemed faculty, staff, family, friends, loved ones, and my fellow graduates of the Rutgers School of Public Health. Each of us came to public health for a reason, a question we wanted answered, a problem we could no longer ignore, a community we wanted to serve more justly, more compassionately, and more fully. For those of you who may not know me, my name is Luis Cordero. I'm a first-generation graduate student from Chicago in the population aging concentration. Service has long been at the center of who I am, from serving as a volunteer ombudsman to partnering with community organizations like Lorenzo's House, which supports families living with younger onset dementia. That same commitment has taken me across the world as a Watson Fellow, where I traveled to 10 countries, lived with older adults, and explored long-term care facilities across cultures. Each of those experiences only deepened what I first learned through caregiving, that dignity matters, listening matters, and sometimes the most important thing we can do is reframe how we see care, aging, and one another. Today, I am also proud to be part of a geriatric workforce program that supports age-friendly training and care. This day is also especially meaningful to me because it is also my mother's late birthday. She, thank you. She, along with the people who loved, raised, and continue to shape me, taught me one of the most important lessons I will carry into public health today: the power of presence, the power of listening, the power of showing up for someone even when there is no easy answer, no cure, or no perfect thing to say. Long before I had the language of risk factors or health systems, I understood care through lived experience. I understood it as a young caregiver to my late mother and late grandmother. I understood it by watching my mother navigate a healthcare system that did not always provide the compassion, support, or dignity she deserved as she lived with younger onset dementia. That experience shaped me, it challenged me, and it led me to ask not only how we treat disease, but how we treat people. It also taught me that healthcare exists far beyond hospital walls. It lives in homes, in waiting rooms, in relationships, and in the quiet, unseen moments when someone is simply trying to make it through the day with dignity. That journey is what led me here to public health. Public health gave me a framework for what I already felt deeply in my bones, that health is never only about the body or a medical visit. It is about whether people are seen, whether they are heard, whether they are valued, and whether our systems make it possible not just to survive, but to live with dignity and a sense of belonging. And if there is one truth I hope we carry with us today, graduates, it is this: aging is public health. Aging is not a niche concern. It is not something to fear. It is not something that belongs only to clinics, nursing homes, or someone else's family. Aging belongs to all of us. Whether we like it or not, we are all aging. The people we love are aging. The communities we serve are aging. And the future of public health will depend in large part on whether we are willing to take that seriously. Who gets to age in community? Who has access to care, transportation, housing, and support? Who is living with dementia in silence? Who has a caregiver, and who is carrying that responsibility alone? Who is aging with dignity, and who is being forgotten? These are not abstract questions, they're urgent public health ones. They are human questions, and they require all of us. As our society grows older, we are being called to think differently about what it means to create health. Not just health that adds years to life, but health that adds life to years. Not just systems that prolong survival, but systems that honor humanity. This is why this work matters now more than ever. We are entering this field at a time when public health can feel vulnerable, even frightening. At times it feels underfunded, misunderstood, and unsafe. There will be moments when the work feels heavy, but there will be moments when the barriers seem too large, the system too slow, and the change too distant. But I want to remind all of us today, do not let that stop you. Instead, let it sharpen your vision. Let it deepen your humanity. Let it propel you. Let it remind you why you came into this work in the first place. Because your passion matters. Your ideas matter. Your vision matters. Even when it feels small, it is not. It plants seeds. It lays foundation. It opens up the doors for those who will come after you. As Oprah once said, your real job in life is to figure out what it is you are called to do. I think many of us here are sitting because one way or the other, public health called and we answered. To me, that call is about building a world where people can live fully, age with dignity, and be cared for in a way that honors their humanity. It is about remembering that every data set, every policy, every program, and every intervention is at its core about human lives. So as you leave here and step into your careers and continue on those careers, I ask you not only to follow your passion, but to put that passion into practice through service. Volunteer your time, offer your skills, show up for communities whose needs are too often overlooked. For some of you, that may mean mentoring students, serving in local health departments, supporting caregivers, advocating for older adults, or just spending time at the local church or food pantry. Whatever form that service takes, I also ask you to make room for aging in the work you do. Service does not always have to be grand to be meaningful. Sometimes the most transformative thing we can do is our presence, or in Oprah's words, to extend yourself in kindness to anybody is an extension of kindness in the world. If you work in mental health, remember older adults living with grief, depression, memory loss, or isolation. If you work in policy, remember long-term care, caregivers, and the systems that often overlook those growing older. If you work in maternal and child health, remember grandparents raising grandchildren and the intergenerational care that it requires. Or if you work in biostatistics, look closely at whether or not older adults are being included within those data sets and what it shares about equity, aging, and so forth. Again and again in my own work, I have seen that what matters most to people as they age is often simple and deeply human: to be listened to be safe, to have choice, to be known, and to be treated as a person, not a burden. That should not be revolutionary, and yet too often it still is. So I ask you all, let us be the generation of public health professionals that refuses to look away from aging. Let us be the generation that leads with service, builds with intention, and centers dignity in the systems we shape. Let us create a more just and humane world, one where growing older is not feared, hidden, or neglected, instead supported with compassion, belonging, and care. And I want to leave you with one final reminder as we commit ourselves to improving the health of others. We also must remember that we too are aging. Public health is not only about the population out there, it is about us, about the world we are helping create, about the kind of future we ourselves hope to grow into. So I leave you with these questions, graduates. What kind of age-friendly future am I helping create? What kind of care will I hope to receive one day? What kind of older adult do I hope to become? And what kind of world will I leave behind for those who come after me? May those questions humble you, may they keep us grounded, and may they keep us courageous. I stand here in gratitude to my family, my mentors, my classmates, my mother and grandmother, whose life continues to shape how I understand care and courage and presence. Congratulations, class of 2026. May we build a healthier world, but a more humane one, a world where every person has the chance to age with dignity, be cared for with compassion, and live with belonging. Thank you.
I know now that I'm 30 years old, I feel a lot better after Luis spoke. So thank you, Luis. I would now like to present the Senator Frank R. Lautenberg Annual Award and Lecture in Public Health. It is my honor, it is my great, great honor and privilege to announce that Dr. Vin Gupta as the 2026 Lautenberg Annual Awardee. Will Dr. Gupta please join me at the podium? A nationally recognized health communicator, advocate, and systems leader, Dr. Gupta has dedicated his career to translating complex public health and health policy issues into clear and actionable information. At a time when misinformation threatens public trust and health equity, his work has been instrumental in helping diverse audiences understand evidence-based guidance and make informed decisions that protect individual and community health. Dr. Gupta joins a distinguished lineage of Lautenberg Award honorees and speakers who exemplify a bold and forward-looking vision of academic public health, real modern academic public health. This vision moves decisively beyond antiquated frameworks that have failed us in recent decades, embracing instead a holistic, humanistic, and multidisciplinary understanding of what public health truly is today, what it must be for the future, and how our school is defined. I'm happy to present Dr. Gupta this award. Congratulations, Dr. Gupta. And I'll take this for you. And now it is my pleasure to give Dr. Gupta the audience for what I'm sure will be an amazing treat. Dr. Gupta, thank you.
Good afternoon. Dean Halkitis, distinguished members of the board, esteemed faculty, honored members of the Rutgers School of Public Health, to the families and loved ones who have helped make this day possible, and most importantly, to the radiant class of 2026. I am profoundly thankful and humbled to be with you on one of the most important days of your already impactful lives. This is a celebration of discipline, resilience, sacrifice, and persistence through uncertainty. You've spent years learning how health is shaped not just by biology, but by systems, by policy, by communication, environment, technology, and trust. And now you enter a world at a moment when all these forces are colliding in ways we've never quite seen before. I know a lot of the speakers have touched on these themes, and I'll be leaning into them. Because public health is no longer operating quietly in the background of society. It is now at the center of how communities function, how economies survive, how governments respond, and ultimately, how human beings trust one another. And that means the work ahead of you matters enormously. You are entering the world of public health at a time of significant possibility and real tension. Science is advancing faster than at any point in human history. Technology is transforming how we diagnose and even think about disease. And at the same time, trust in the very foundations of our proud profession has become fragile. Public confidence in institutions, especially ours, is being tested. Information moves faster than evidence, and the line between truth and noise has become harder to see. So the question for you isn't just what noble goals will become your life's work, but what will you carry? I'm about 20 years ahead of where many of you sit. I venture just meeting some of you, maybe even more than 20 years, and I come to you this evening with 3 requests. That is it. Not advice, urgent requests, and I hope you'll hear me out. My first ask, and this is resonant with some of the themes from our prior speakers, is to please use your voice. Because if you do not, someone else will. And as we've seen repeatedly since and during the pandemic, horrifying, preventable tragedies happen in silence. Much as if expected of you at a time when many manipulate our mediums of mass communication, especially on all matters health, in the pursuit of clicks, attention, money, and power. We are living in a moment where falsehoods are no longer background noise. They are independent clinical risk factors. I've seen it directly at the bedside even now, perhaps the most significant of them all. For they shape behavior, they change outcomes, and they imperil human lives. And there is no overarching body or institution that will call balls and strikes and save us and ensure accountability and justice. See, during COVID, I lived in 2 very different and unexpected worlds. The intensive care unit and my bespoke Zoom television studio, which was otherwise known as my laptop computer. And often those worlds collided. At one moment, completing rounds on COVID critically ill patients amid unprecedented chaos and anxiety, and the very next finding a solitary space to answer an anchor's questions on a novel virus we were just learning more about. The questions I kept fielding and answering seemingly became more desperate. Quote, my child has asthma. How can he possibly be safe in school? Are we sure that N95 mask on that Thanksgiving flight home will be enough? Is human plasma the magic treatment for severe COVID? How effective is the Pfizer versus the Moderna shot? Can I take both? When is this all going to go away? We're seeing the headlines now. It's not. It's just morphing. On and on, an endless well of concern, insufficiently quenched with any amount of reassurance. I had not planned on a life in news media. You don't move from New York City to Seattle, Washington, if the goal is to become a medical analyst for network news. And yet, as the months turned into years, I embraced the vital importance of setting the record straight, of taking that call in the hospital corridor, of doing that television interview, not for ego or for fame, but rather in embrace of an irrevocable truth. If we do not define the truth, even if it requires a massive leap outside of our comfort zone, someone else will do it for us. And they already were. So let me be clear. Silence is not neutrality. Silence is permission. The debate is shifting. It was once COVID vaccines, now it's the measles vaccine. And debating raw versus pasteurized milk, fluoride in our water supply, or the optimal amount of saturated fat intake in a healthy diet. Nothing is settled anymore. Everything is up for debate. We're told, it's hot outside, we're told to ignore the unrelenting heat that we feel on our skin or the wildfire smoke that you may breathe into your lungs as normal climactic variants rather than acknowledge their connection to environmental change. The controversies and the debates will morph, and you may feel the pull to stay quiet. And yet there is no version of your profession where vocal advocacy is optional any longer. Our society demands public health leaders like you to carry that responsibility, to be persuaders, communicators, bastions of rational thought. No one else is better positioned to do it. We need your generation to fill that void. This does not mean that you need to be on national television, but it does mean you need to be present. Dr. Alkitis talked about presence. In your community and nonprofit boards, in conversations where policy is being formed, in the voting booth during local, state, and national elections, in moments where your voice carries trust to shape behaviors. Because today, harm does not just enter through biology. It enters through information. And part of your job now is to stop it at the source. My second request is to stay curious. Broaden, please do not narrow. Early in my career, I thought I knew what success meant following a very linear path. But the questions that ultimately shaped my life existed far outside a traditional medical training program. Why do some communities live dramatically shorter than others? Why does someone, where someone is born, predict their health more accurately than a battery of lab tests? How do policy decisions ripple through generations? In what ways do technology and communication shape human behavior at scale? Following these questions took me on a whirlwind, exhilarating and very unplanned journey. In a decade, I went from researching malaria in Uganda to taking the oath of American military service in Alabama, to studying international relations at Cambridge, and then finally pursuing a role at Amazon, leading their direct-to-consumer healthcare strategy. And then COVID happened. And suddenly everything connected. My training mattered, but so did communication, so did policy, so did technology and understanding how large integrated data systems work. In that moment, it became clear. Impact does not scale through expertise alone. It scales through diverse perspectives. The world you are entering will not reward narrow excellence alone. It will reward those who can connect disciplines. Between public health and technology, between healthcare and public policy, between data and human behavior. Because our fellow citizens do not live in your field of expertise. They live in the real world, a world shaped by a changing environment, by challenging economics, by a noisy information ecosystem, by systems far beyond the walls of your clinic or your public health department. Curiosity is not a distraction. The next era of public health leadership will require people who can think inside systems and across systems, not just in silos. And that is exactly what your training has prepared you to do. My final request is this, and I know we've heard this again a few times, and I think it's so important to remember it. Please do not lose sight of the human element. We are entering an extraordinary era of technological transformation. You cannot go anywhere and not hear the words artificial intelligence. And I'll say this, I do think artificial intelligence will be a positive force for good in medicine and in public health. I do think predictive analytics will become more powerful. And all of that, data systems will become more sophisticated. And all of that will improve our ability to prevent disease and to save lives. And yet the people we seek to want to help want something more than accuracy and precision. They crave mutual understanding, commiseration, compassion. They want someone who can sit with them when the answer is not clear. Someone who can translate complexity into meaning, probability into reality, and uncertainty into something they can carry. That is all of you, graduates. You are the interface between data, technology, and meaning, between prediction and trust. So embrace the tools, use them, get good at them, but never outsource the one thing that defines this profession, the human element. Because in the end, public health is not simply a data problem, it is quintessentially a human one. Finally, I'll say that at some point, each of us is asked, quietly, without ceremony, whether what we'll say and what we know to be true, whether we'll say that, or whether we'll let the moment pass because it is easier. I've been there, not long ago when the cost of speaking plainly felt higher than usual, and the incentives to stay quiet were all around. But a life and a record have a way of accumulating these choices. They become your personal record. You do not have to be loud, but you do have to be clear. Know what you stand for, say it when it matters, and trust that, in the long run, it is the only thing that will ever really hold. Class of 2026, we are all very proud of you, and the future of our glorious and most noble profession is now in your capable hands. Thank you and congratulations.
Come on, one more time for Dr. Gupta. So you got it, right? Science, be brave, be human, keep those bullies close at hand, understand them, but understand that they have to also be kept in place. We're going to look to you to do all of that. I'm also looking for the next generation of public health influencers on X and all of those social network platforms to like do the work. So do that work for us, guys, because I still don't know how to do 90% of what my phone does. I just don't know. It just keeps ringing and I'm like, what is that? So you've heard from us all. And now we've come to the most important part of the afternoon, which is to recognize our graduates from the class of 2026. They will include those who are receiving the Doctor of Public Health degree, the Doctor of Philosophy degree, the Post-Baccalaureate Certificate, the Masters of Science degrees, and the Master of Public Health degrees. Dr. Emily Merchant, who is Assistant Professor in the Department of Urban Global Public Health, will be recognizing our graduates by degree, and Mrs. Claire Brown, Director of Student Experiences and Alumni Affairs, will present our graduates with important information about staying connected to the school. Graduates, please follow the directions of the individuals asking you to rise. In lieu of a handshake, you may choose to elbow bump the dean, that's me, before posing for a photo. It is now with great pleasure that we first recognize our doctoral graduates from the class of 2026. Dr. Merchant.
We will now hood our Doctor of Public Health graduates. Will the Doctor of Public Health graduates of the class of 2026 and their mentors please come forward? As your name is announced, please proceed across the stage to be hooded by your mentor. Dr. Shazia Kazi is being hooded by Dr. Mackie Friedman. Dr. Melanie Shevchik is being hooded by Dr. Leslie Cantor. Dr. Viji Valayan is being hooded by Dr. Vince Silenzio. We will now hood our Doctor of Philosophy graduates. Will the Doctor of Philosophy graduates of the class of 2026 and their mentor please come forward? As your name is announced, please proceed across the stage to be hooded by your mentor. Dr. Ushiwini Urunuchulam is being hooded by Dr. Judith Graber. Dr. Kate Lubina is being hooded by Dr. Judith Graber. Dr. Tina Thuramdasani is being hooded by Drs. Jaya Sadagopan and Alyssa Bandera. Dr. Wei Shia is being hooded by Dr. Emily Barrett. We now recognize our 2026 Master of Science in Biostatistics degree graduates. Will the graduates of the class of 2026 who are receiving the Master of Science in Biostatistics degree please come forward to be recognized? Danya Anna Jogajan. Jeremy Piano. Jiqi Wang. Ayushi Vivhare. Lauren Ramirez. Mira Arshad. Dean Sobel. Ayush Taraftar. Jingtao Chio. We now recognize our 2026 Master of Science in Epidemiology degree recipients. Will the graduates from the class of 2026 who are receiving the Master of Science in Epidemiology degree please come forward to be recognized? Silas Silverman Gittin. Deep Shah. Oluwatosin Fufa. Prasad Prabhakar. Isha Patel. Abunub Armenius. Stephen Gershik. Darshit Patel. We now recognize our 2026 Master of Science in Health Outcomes, Policy, and Economics degree graduates. Will the graduates of the class of 2026 who are receiving the Master of Science in Health Outcomes, Policy, and Economics degree please come forward to be recognized? Ying Xuan Lin. Anitha Raja Gopalan. Anusha Vasudevan. Lauren Brown. We now recognize our 2026 Master of Public Health degree graduates. This year, we are proud to recognize our 40th Master of Public Health class. Luis Cordero. Sana Nasiri. Shivani Patel. Emily Lees. Moonveen Kaur. Okay. That's okay. Maria Salas. Julene Best. Layla Tumimi. Brittany Bernstein. Rosaline B. Tujrian Ahmad. Deepa Dev. Lori Jimenez. Matthew Burney. Prunali Karkar. Zooyu Ahmed. Daniel Simpson Jr. Roha Khan. Javeri Butt. Maria Chowdhury. Melanie Ingles. Ariani Isabel. Sebastian Nata. Abisoye Oladejo. Ruth Hartnett. Marissa Gravel. Nina Sullivan. Samway Lee. Samu Lee. Stanley Romaine. Azana Saul. Daniela Munoz. Tanya Asma. Isabella Verdugo Hernandez. Sadaf Arij. Vaisali Patel. Misha Patel. Riddhi Pandya. Michelle McDermott. Sarah Umer. Timnit Rawa Muba Afi Riki. Caitlin Adkins. Caroline Makokisi. Narai McKnight. Jennifer Hoyos. Wilson Oroyo. Julia Ahe Nawi. Aviana Peterson. Nija Davenport. Carla Haro. Usadu Grant. Asado Grant. Kenny Ruiz. Pratham Tamakuvala. Jazin Myotlat. Armin Aziz. Rachel Thompson. Angelin James. Kevin Patel. Kunishken Viri Kian. Tava Shah. Matthew Santos. Layla Catherine Fahim Koster. Taylor Rafferty. Alex Fletcher. Shreya Patel. Hegmanji Rawal. Victoria Oyeneye. Haruna Akiyama. Ebenezer Jamal. Jacqueline Duvali. Riley Burak. Justin Dion Arin. Emily Ham. Nicole Kobiak. Brianna Vo. Francis Legaspi. Jean Cadeau. Vincent Moise. Robert Weissman. Priscille Myrtle Harder. Anne Uzoma. Heather Butler. Martha Nyangulu. Deborah Germain. Sigrid Solis. Anne-Marie Dimian. Kelsey Warren. Arlene Tara Zunan. Jeffrey Suratelli. Nubia Brito. Cameron Creeman. Rushmi Patel. Alian Jackson. Nuseba Ali. Husna Rahman. Haya Siddiqui. Patrice Sherristal. Megan Eileen Buretta. Caitlin Carbonera. Chidima Brittany Igiwe. Virginia Yowiharo. Sean Kaduhi. Jennifer Souso. Daisha Warren. Makita Boseman. Isabel Murphy. Juliana Garvey. Cassandra Angelo. Pranitha Rajkumar. Joseph Musari. Donette Jones. Patricia Zan Baptiste. Farman Shahabadin. Sunjana Gundikota. Monica Pulu. Sarah Foran. Ashby Smith Carrington. Heidi Erb. Naga Guduru. Melissa Shermer. Latoya Camacho. Farhan Ahmed. Muhammad Salim. Quincy Hunter. Uzo Achibi. Gerline Carr. Ahana Upadhyaya. Asia Ritger. Aze Sandra Impanu Ruguwu. Doris Oomayo Tony Mwaa Betsoho. Urish Hamuda. Ruan Esmail. Jodian Reed. Alexandra Blinova. Congratulations to all of the graduates and their families, friends, loved ones, and guests. Vice Dean Deanna Kerrigan will now provide closing remarks. Vice Dean Kerrigan.
Thank you, Emily. Congratulations again to the class of 2026. Thank you to Dean Halkitis, our convocation speaker, Dr. Vin Gupta, Board of Governors Vice Chair, Dr. James Doherty, Alum and Dean's Leadership Council Chair, Dr. Mariam Rashid, Bergen Awardee Luis Cordero, and the faculty and staff, especially Nakesha Gonzalez, for making this ceremony so very special. Most importantly, thank you to all the graduates and families here today to celebrate this important accomplishment and milestone. In the years since I sat where you sit now, I've held a variety of roles in a diversity of settings, including academia, community organizations, governmental agencies, foundations, and in these spaces, I have had the privilege of witnessing the essential ingredient that allows a given public health initiative or institution, in this case, our School of Public Health, the ability to make a meaningful impact and a sustained difference in the health and well-being of communities. While I have not been here at the Rutgers School of Public Health very long, having just started last November, I've been here long enough to have seen that essential ingredient and the core values that drew me here in vibrant action. If I had to distill it down to one key element, it would be absolutely the focus on what it fundamentally means to be human, the humanity that Dean Halkitis spoke of, to the simple fact that the lives and the health and the well-being of all people, including each one of us sitting here today, are ultimately and clearly interconnected. There is no human being better than another. There is no human being more or less deserving of health and well-being. To be human in essence means to be one people, one public, one community. And public health depends not only on saying those words, but also on embodying them, with a conviction that stems from a deep awareness of and commitment to living out that reality of interconnectedness and shared humanity in every interaction that we have with one another. And as Dean Halkitis wisely said, by treating each other with dignity, respect, and compassion. And that is what meaningful change in public health comes down to. When we mix that essential ingredient of humanity-driven public health together with strong foundational professional training in public health research, programming, and policy solutions to the very human challenges that we are facing, we can do and make a profound difference together. We can do transformative things, both as individuals and a collective. And that transformative energy is what I am witnessing here at Rutgers. It is magic, a magic that we all in our world desperately need in this moment, a moment that can feel daunting, scary, threatening. So do not forget the importance of your rigorous preparation that you've received here in epidemiology and biostatistics, social and behavioral sciences, urban and global health, and environmental health and justice. But please also remember that those technical tools are only transformative in terms of people's everyday lives when they are combined with the magic that you have gained and shared during your time here at Rutgers. That key ingredient being to humanize public health in order to advance every human being's equal right to live safely and in pursuit of their full potential and dreams, and in that process to be as healthy and as well as possible. Each of you will carry the Rutgers School of Public Health magic with you in your pocket and your heart, and it is that magic that will allow you to make the difference we need in this moment and beyond. And if one day, and perhaps on a hard day, and believe me, we all face those, you forget that you have these tools and that magic, please reach out, as we will be happy and proud to remind you of the gifts you are carrying forward and contributing to this world that is calling out for your service and for a humanity and community-centered public health. Congratulations again to the class of 2026. Thank you. Families and guests, please stay seated until our platform party and graduates have processed out. Graduates, please wait for the platform party to process out and follow the directions of the aisle staff. Faculty, please rise.